Hi, welcome to Hub Bites. I'm Sanil, Rege, consultant psychiatrist. Today I'll be taking you through one of the articles that we published on Psychiatrists Hub titled Mental Health Challenges for Healthcare Workers During the COVID-19 Pandemic. As we know that the COVID-19 pandemic, the outbreak started in Wuhan, China, and to date it's spread across about 193 countries across the globe. Now clearly there's going to be a significant impact on healthcare workers, and we've tried to summarize the key psychological impacts and the management strategies to assist with that. Now, obviously with the outbreak and the pandemic, decision-making in times of uncertainty can be quite difficult. So some of the decisions that healthcare workers are going to face are going to be around allocation of resources, balancing the physical and mental health needs of the workers, aligning patient needs with the needs of the family, and of course caring for severely unwell patients. Now, the main stresses that were identified for healthcare workers during the COVID-19 pandemic, and most of these studies come from China. Firstly, shortages of personal protection equipment and lack of clarity around the indications for use. So protective personal equipment, the PPE. Intense scrutiny of international media. We live in the age of social media, and we know that we can constantly keep in touch with the different things happening around the globe. Isolation from family and other supports. Fears of transmitting the virus to family and others. Rapidly expanding workload with an increasing number of suspected and confirmed cases. Progressively depleted workforce due to illness and isolation of staff. Incidents of hostility and even aggression towards medical personnel. And finally, lack of effective treatments for unwell patients to date. So clearly this puts healthcare workers in a very difficult position, and from a psychological perspective, two concepts that are really important are the concepts of burnout and moral injury. We know that the concept of burnout describes a state of extreme physical and psychological exhaustion brought on by the demands of certain professions, and healthcare workers is right at the front there. Moral injury, the other concept, is defined as psychological distress that results from actions or lack of them which violate someone's moral or ethical code. The huge current effort to ensure adequate staffing and resources may be successful, but it looks likely that during the COVID-19 outbreak, many healthcare workers will encounter situations where they cannot say to grieving relatives, "We did all we could," but only "we did our best with staff and resources available, but it was not enough." That is the seed of moral injury. So what are the interventions that one can consider to assist or to alleviate the impact on healthcare workers? So they can be divided into three domains. The first one is strategies to reduce specific workplace stresses. And these include, early intervention, a reflection for healthcare staff, providing training, etc. The second domain is support for general welfare of medical staff. And this might include accommodation facilities, for example, supplies for healthcare staff, including protective equipment, providing adequate and clear information to healthcare staff about the use, and of course ensuring aftercare. So, looking after people and monitoring for these vulnerable people even after the pandemic ends. And finally, specialized psychological support for medical staff. Now, this might include a peer support, counseling support, and of course, close monitoring as well, and an attitude of sort of openness and transparency so that they can approach key supervisors, for example, if they do run into difficulties. So these are some of the strategies and, of course, the psychological impact on healthcare workers during the pandemic that we need to take into account. You can read the full article on the psychiatristshub.com, and we hope that you find this useful. Thank you.